Carmen. I'm doing the NG tube skill today. First, I would follow all GPSP guidelines, and if I were to administer any medication for the NG tube, I'd follow my 11 rights and my 3 checks. All right, let's go ahead and get started. I would knock. Hello, my name is Carmen. I'm going to be your nurse today. Can you go ahead and verify your name and date of birth for me? Okay, matches a wristband. And do you have any allergies that I need to make note of today? No? Okay, well, I would do any prior assessments that are needed, such as a focused GI assessment, anything to see if there's any trauma with the facial structure, any abnormalities for face or throat. And all of my materials are within the expiration date and clean and dry. I'll go ahead and get my NG tube and go ahead and get my piece of tape ready. Right. And I would measure from the nostril to the ear to the xiphoid process. I've got that. And I'd go ahead and mark that with a piece of tape. And I'd go ahead, see it in its packaging. Switch my glove. And hygiene. I'd go ahead and get my tape ready for whenever I have to secure it. Alright, go ahead and get that right back out of the packaging. And I dilute it. And if my patient was allowed to have water, I'd go ahead and give them a drink of water. Alright, I'd go ahead and have my patient tilt their head back, and I'd insert the NG tube, and making them swallow, and then advancing the NG tube, and I'd bridge the pharynx, and then I'd have them point down to their chest. And if there was any distress during this, I would go ahead and stop the procedure. And then I'd loosely secure it. And since it's loosely secured now, I'd go ahead and order for a chest x-ray. And I'd go ahead and check the pH. Getting just enough to check the pH. And the pH was under 5. And at this point, I would go ahead and mark the tube and then measure got that measurement, and I document that. And as soon as I got that documented, go ahead and secure it. Making sure that it's comfortable. And I'd make sure that the patient can move its head side to side and it is comfortable. And I would apply any extra tape if needed. And then I'd go ahead and check the order to see if it just needed to be recapped or connected to the suction. And to our order, it had a low suction. And then I would keep it, since it's a double lumen, above the stomach, and I'd secure it. And then I would clean up all of my supplies. And then I'd report and record.